Travis, and welcome to tonight's edition of the Regional News. We start off in Jamaica. Now, the island is expected to begin administering the Oxford AstraZeneca coronavirus vaccine in February, 2 months ahead of the scheduled April rollout. Minister of Health and Wellness Dr. Christopher Tufton revealed the development on Tuesday. The island will begin administering the shots in mid-February. In a sitting of Parliament, Dr. Tufton gave further details on the allocation of the shots, which will first be administered to healthcare workers and seniors. And I quote, Jamaica will receive approximately 140,000 doses of vaccines from COVAX and up to 249,000 of the AstraZeneca vaccines by mid-February. This means that some 125,000 Jamaicans should receive the vaccine in the latter part of February into March, end of quote, Tufton stated. According to the New York Times, the AstraZeneca vaccine prevents the transmission of COVID-19 by nearly 2/3. Among those to receive the vaccines are frontline workers, including nurses and doctors, and then vulnerable persons. Chief among those are persons 60 years and older. Dr. Tufton said that the Ministry of Health still has plans to vaccinate 60% of the population this year, but that percentage could change depending on the supply of the drug. He said that the government is looking to source additional vaccines from Mexico, China, United Kingdom, and Cuba, in addition to the African Medical Supplies Platform. While the Ministry of Health prepares the island for vaccination, Dr. Tufton said that Jamaicans need to remain vigilant and abide by the safety protocols. In the last 5 days, Jamaica recorded an additional 538 COVID-19 cases, with as many as 101 patients being hospitalized. The number of deaths have increased by 9, and between 8 and 11 persons daily are considered to be in a critical condition. Dr. Tufton said that as early as next week, the ministry will begin meeting with private health practitioners to discuss their role in the distribution of the vaccines, especially among the high-risk groups. And now for some news coming out of the aviation sector. Anyone wanting to leave Trinidad and Tobago on a Caribbean Airlines flight will need an exemption from the Ministry of National Security, the Twin Island Republic flag carrier said on Monday. Kyle said in a customer advisory that effective immediately, all departing passengers must adhere to the new online exemption process implemented by the Ministry of National Security under the country's COVID-19 measures. The new protocol was announced by the Minister of National Security, Stuart Young, on January 23. And I quote, prior to their date of travel, persons wishing to depart Trinidad and Tobago for any international or regional destination must apply for a travel exemption, end of quote. And it further said, and I quote, customers are reminded that their exemption approvals are applied against the respective passports submitted on their exemption request forms, and they must present the same travel documents used with the request forms at check-in, end of quote. Kyle added that passengers may obtain online exemptions up to the time of check-in. The state-owned airline also encouraged all passengers to verify the entry requirements and other important travel information for their intended destination. And finally, around 500,000 Barbadians could start being vaccinated against the COVID-19 virus in the near future. During a 35-minute national address on a Tuesday, Prime Minister Mia Amor Motley said a plea to World Power India for help had borne fruit, and Barbados should receive around 100,000 AstraZeneca vaccines from that nation. Barbados had requested both a donation and a chance to purchase thousands of the vaccine doses. Motley said frontline workers would be the first to receive their jabs, each person receiving 2, along with elderly Barbadians and those considered most at risk who suffer from chronic disease. Law enforcement and national security officers, along with other staffers considered essential workers, would be next in line. She added she was well aware that not every Barbadian would want to be vaccinated. The Prime Minister said she had already asked the Queen Elizabeth Hospital and the Ministry of Health through the polyclinic system to identify those patients who would be considered most vulnerable to infection in a COVID-19 environment. And that is it for our regional news this evening. And I continue to urge our viewers to stay indoors, wear those masks, use those hand sanitizers, and continue practicing social distancing. Back to you, Travis.